Okay, well, I have the honor and the privilege of introducing our next speaker, Dr. Sue Hassmiller. And just a little bit about Dr. Hassmiller here. Again, just honor absolutely to be able to introduce her. So just a little bit about Dr. Hassmiller. She is the Senior Advisor for Nursing at the Robert Wood Johnson Foundation. She was a Senior Scholar in Residency and Senior Advisor to the President for the National Academy of Medicine from January of 2019 through August 2021. In this role, she served as a key member of the leadership team for the report, The Future of Nursing 2020 through 2030, Charting a Path to Achieve Health Equity. This report was released in May of 2021. In partnership with AARP, she directs the Foundation's Future of Nursing Campaign for Action. And I would love to welcome Dr. Sue Hassmiller.
I'm trying to take myself off a video, but it says I cannot start my video. Oh, there, start my video. Now.
Welcome.
You cannot start your video because the host has stopped it, it says. So that's the message I'm getting when
we see you, Sue. Your video is up.
Yes, we see you. Welcome.
Okay, so you have all the control. That's a good lesson for me. Just give up all the control.
Welcome.
Thank you so much. Thank you so much. So I will just start right in. And I thank Denise and Lisa so very much. I have to say that everybody can see me in the slides and everything before I sort of dive in here?
Yes, ma'am.
Okay, wonderful. So I have to say that meditation that we were just brought through was probably the best meditation via Zoom that I've ever attended. You had all of the pictures, you had the gong just ever so slightly in the background, and the words were beautiful. So thank you for that. I mean, other people take us through these meditations, but it's, yeah, yours was the best. So thank you so much. So I'm delighted to be with you all today. I'll always remember the warmth and compassion that this group showed me when I spoke last time at your meeting shortly after my husband's death. I will never, ever, ever forget that meeting. I'm so grateful to each of you for taking the time to be here. And I understand that you have a wonderful sponsor that have allowed everyone to attend free of charge. So that is fabulous. It's been an extraordinarily difficult time for the nurses in your state, however. Between the hurricanes and the pandemic, I appreciate the resilience that you've shown, and you just keep showing. Louisiana's, you deserve so much credit, and you don't always get it nationwide. You hear about other states, but you really deserve a lot of credit. How you get up each day and care for people, families, and communities. Denise shared your strategic plan with me before this meeting, and I am really awed by the breadth of your ambition and determination to advance the recommendations in the Future of Nursing 2020-2030 report. It's just, after working so hard on this report, I was there for 3 years from developing it and the committee, everything. But then to come out of this end and see folks like yourselves working on it, taking it seriously and wanting to really lead the pack, believe me, this is all I need to make me really happy. Next slide, please. I want to take a moment first to pause, and acknowledge, I know that you already did this, but for me, what an unprecedented and difficult time it is for nursing writ large, not only in Louisiana, but around the country and around the world. especially for everyone who's really on the front lines feeling burnout and you've experienced personal hardships as a result of the pandemic and the national disasters that have hit Louisiana hard. So I want to lift up all of you, all of the nurses in Louisiana who are struggling and those who are leaving the field. I don't like to say those words at all. Let's remember those who are sick or who have died from COVID, and let's take a moment of silence for them to pause, to remember, and to commit to a better future for nursing. Okay. I'm gonna go ahead because we really had such a wonderful meditation before I came on. So next slide, we should be on slide 3. So thank you for inviting me to share the report's findings with you today and to talk about how we can all work together to advance the report's recommendations to make the nursing profession the best it can be for all of us. This new report arrives at an inflection point for the nursing profession. The past 2 years and more, right, and more have increased nurses' visibility, but it's come at a great cost to our profession. Nurses are emotionally spent from caring for COVID patients. The pandemic has also laid bare the stark inequities that have persisted across the generation. If we didn't know it now, we certainly know it. If we didn't know it then, we certainly know it now. Students are entering the profession. I hope some students are joining us today. It always gives me extra energy when we have students in the audience. So students are entering the profession during a time that is demanding a stronger, more diversified nursing workforce that is prepared to provide care, promote health and well-being among nurses, individuals, and communities, and now address systemic inequities that have fueled wide and persistent health disparities. The report is aspirational and ambitious. Hopefully you've taken a look at it and will agree with me. The future of nursing during the next 10 years will be about creating a more fair and just world for everyone, and all of you will be helping to create that world. Next slide. The report that I was just talking about is really the second major report released by the National Academy of Medicine on the future of nursing. Hopefully, many of you in the audience will remember this first report that's shown on your screen. It reconceptualized the role of nurses in transforming the healthcare system. The Robert Wood Johnson Foundation and AARP believe that the recommendations in this particular report were too important to sit on a shelf. So that's when we really formed the Future of Nursing Campaign for Action that you all are a part of, a nationwide initiative to advance the recommendations of this first report. The Action Coalition, including yours, have been key to our success in strengthening nursing education, advancing practice, promoting leadership, and increasing workforce diversity. And I know Louisiana has also been working on getting nurses on boards. You have been just such a stellar Action Coalition. And it all comes from your leadership, by the way. If anybody asks for hints as to why some Action Coalitions do better, it's the leadership and all the engagement of everyone who's really doing their part. So together we built the capacity of the nursing workforce to expand high quality care to more Americans. This new report builds on the gains that we have made. Next slide. As the nursing field built its capacity, and we are still building our capacity, I have to say, sadly so, that I think we've taken a few steps backwards with our profession. We need to build our capacity. We've been under such moral duress. But my foundation, when we were talking about doing something again, it was in the realm of what do we do with this nursing capacity? We have so many nurses in the country, 4 million, right? Over 4 million. And we really want to value our workforce. So to what end? And this is it. We knew that the United States spends more than 3.5 trillion per year on healthcare, but underperforms on nearly every single metric. What? The United States of America? Absolutely. You're used to this in Louisiana. I know when we get grant proposals in from Louisiana, we always see, in the first paragraph, Louisiana is, at the bottom of the list for this or that or the other thing. Louisiana, Mississippi, right? You take turns, but we don't like this. The disparities are just horrible. And, this is where we believe nurses can come in. The Commonwealth Fund released a report last August showing that the United States ranks last among high-income nations when it comes to equity, access to care, administrative efficiency, and healthcare outcomes. It's a head scratcher, isn't it? Actually, it's not. If you really think about our country and where we are, the haves and the have-nots, you can see why we are in such dire straits with our outcomes. Next slide, please. Slide 6. Life expectancy, infant mortality, maternal mortality are all worse in the United States compared with other developed nations. Disparities in healthcare access and outcomes related to race, income, geography, and other social and environmental factors are also common. This slide shows that individuals who earn less in the United States have a lower life expectancy. Next slide. But we also knew that nurses, we do, have a long history of tackling the many social and economic drivers that affect health. Nurses are the largest and the most trusted, yes, we are, segment of the healthcare workforce. Nurses work in a range of settings, and they are often the first and the most frequent healthcare contact with individuals, families, and communities. In 2019, RWJF asked the National Academy of Medicine to chart a path for the nursing profession to reduce health inequities and improve the health and well-being of the nation. The report is being released during a critical time in our nation's history and in nursing, when it's clear we must dismantle structural and interpersonal racism to eliminate inequities. Nursing needs to be at the forefront, and we can be, of creating a more fair and just world. A more fair and just world. What do you think about that? And we need policy reforms to unleash our potential. The report's vision is audacious: the achievement of health equity in the United States built on a strengthened nursing capacity, diversity, and expertise. The report notes that to achieve the committee's vision, a significant investment in broader and deeper development of nursing leaders will be needed. We'll get onto that in a few more minutes. So that's where you come in as teachers and leaders, and both, who are educating the next generation of nurses who must be prepared to advance health equity. Next slide, please. Achieving health equity is the most salient issue of our time. Let me say that again, that achieving health equity is the most salient issue of our time. And this, my friends and colleagues, is nursing's time to lead the charge. Our country has long failed to give everyone a fair and just opportunity for health. Health is greatly influenced by access to jobs that pay a living wage, safe housing, reliable transportation, walkable neighborhoods, good schools, fresh food, and adequate green spaces. Factors like our race and ethnicity, income level, sexual orientation, disabilities, and the conditions where we live, our neighborhoods, right? Predict whether we are more likely to suffer from preventable, costly medical conditions and live shorter lives. In other words, the social determinants of health. Next slide. Compared to white people, Black, Indigenous, and Latino individuals are more likely to live in neighborhoods that lack healthy food options, green spaces, places to exercise, safety, and have more pollution. This is due to structural racism, defined as a system in which public policies, institutional practices, cultural representations, and other norms of work, in various and often reinforcing ways to perpetuate racial group inequity. Redlining, for example, was used throughout the country in the 1930s, started in the 1930s, to keep Black people restricted to certain areas of a community that lacked social and economic resources. The slide shows a map of New Orleans with the yellow areas defined as definitely declining and the red areas as hazardous. There's a lot of red on this map. Banks were encouraged never to support loans for home ownership in these areas. The map was produced by one of the New Deal's most important agencies, the Homeowners Loan Corporation. Redlining is one of the many reasons for health inequities today. Next slide. These structural inequities and racism experienced by people of color on a daily basis lead to stress, poor physical and mental health, and the advent of chronic conditions sooner than among white people. These factors also put Black and brown people at higher risk for COVID, as we all know. Next slide. Low-income individuals and people of color are more likely to live in crowded housing, rely on public transportation, and be essential workers. They are also more likely to lack health insurance and less likely to be able to access care. This has made it very difficult and often nearly impossible to follow recommended social distancing guidelines during the pandemic and puts them at a higher risk of getting sick and dying of COVID. Next slide. The brutal killings in 2020 of George Floyd and Breonna Taylor by police officers and Ahmaud Arbery by armed white men while he was out for a jog, and the unconscionable long list of Black and Latino victims who preceded them and came after them, as well as the over 6,600 reports of hate incidents against Asian Americans and Pacific Islanders in 2021 underscore the need to adequately acknowledge, confront, and dismantle all systems of structural racism. Scholar Tricia Rose likens systemic racism to a series of interlocking gears in the systems of housing, education, health, banking, and criminal justice that simultaneously work perfectly together to produce routine advantages for white people while producing cumulative and chronic adverse outcomes for Black people. Systemic racism also exists within nursing. For too long, the nursing profession has identified as being a caring profession, nothing wrong with that, right? And maintained an identity of color blindness. As a result, we have not addressed systemic barriers that keep the nursing profession overwhelmingly white and female. So we must all commit to a more just future. And this, my friends and colleagues, is the future of nursing. Next slide. The report is intended to meet this moment. It contains 4 key takeaways and a series of recommendations to unleash the potential for nurses to achieve health equity. These recommendations are the consensus of the committee based on the evidence at the time that this report was written. Next slide. The report calls on the systems that educate, pay, and employ nurses to permanently remove barriers to allow them to do this work, value their contributions, prepare nurses to tackle and understand health equity, and to fully support them. The need to dismantle structural racism and diversify the nursing workforce is woven throughout. So let me talk about this now. Next slide. The first takeaway is to permanently remove nurse practice barriers, something that you're all familiar with in Louisiana. Many people in our country, including yourselves, can't access healthcare because they lack insurance, the ability to pay, and clinics or providers in their geographic area, particularly in rural and urban areas. Nurses can help to bridge the gap in access to care. About 70 to 80% of advanced practice RNs work in primary care. The nurse practitioner field has grown, while the number of physicians going into primary care has remained stagnant or declined. Studies have repeatedly, over and over and over and over again, demonstrated that nurse practitioners provide care that is equivalent to the care provided by physicians. They are less expensive to employ than physicians and more likely to care for vulnerable populations, including those in rural areas. However, their ability to practice fully is limited by state and federal laws. Also, institutional barriers and restrictive health system policies that prohibit them from working to the full extent of their education and training. American Association of Nurse Practitioners designates Louisiana as a restricted state for practice. And I know how much you really wish that were different, and you're working on it. Next slide. The report calls for all organizations to enable all nurses to practice to the full extent of their education and training by removing regulatory and public and private payment limitations and restrictive policies and practices. This recommendation continues the work of the first report. We've been at this issue for a very long time, but now it discusses in more detail lifting barriers that prevent RNs, regular nurses, and licensed practical nurses from practicing to the top of their education and training. These range from restrictions on providing telehealth services to workplace policies that prevent nurses from providing the best possible care. Until all nurses are permitted to practice to the full extent of their education and training, significant and preventable gaps in access to care will continue. For many people, delays in obtaining care lead to worsening of symptoms and disease progression and to greater cost when people ultimately receive care. I'm thrilled that improving access to care remains as one of the things in your strategic plan. I know the environment for scope of practice is tough in Louisiana, but with persistence and partners, you will make inroads. And all of you can advocate to be able to work to the top of your licenses. Work to remove policies in your workplaces that prevent nurse practitioners from writing orders and requesting physician referrals or directing consulting with pharmacists. Make sure your particular practice or practice that you have control over is taking advantage of standing orders, the written protocols in place that permit nurses to order immunizations, screenings, and routine lab tests or medication refills for chronic care management for diabetes, hypertension, hypothyroidism, or other team-based care protocols. I'm really happy to announce that just a few days ago, the governor of New York signed into legislation lifting all practice barriers for APRNs in the state of New York. So that's really fabulous news. And I think in Kansas too, I was following Kansas, and it was just at the governor's signing table in Kansas, and hopefully that went through as well. So let me tell you, if New York and Kansas can do it, just keep plugging along. I am all for Louisiana. Onward and upward. Next slide, please. Slide 17. The second takeaway is to value nurses' contributions, including those of school nurses and public health nurses. The current payment systems are not designed to pay for services that address social and economic drivers of health and advance health equity. They often do not explicitly value nurses' contributions to care. Payment systems can enable nurses to make essential contributions to improving care and outcomes for all patients when they support team-based care, improve communication between providers and patients, and proven interventions and strategies that can reduce health inequities. Nursing roles to advance health equity will only be scaled up if they are valued and paid for. Public and private payment systems should be intentionally designed to support and incentivize healthcare and public health organizations to enable nurses to perform these roles. Next slide. We need to do a much better job of educating nursing students so that they are prepared to promote health equity and improve the health and well-being of everyone. I'm excited that this is also a part of your strategic plan. Students need to be better prepared to understand and identify the complex social and environmental factors that affect health, effectively care for an aging and more diverse population, engage in new professional roles, adapt to new technology, and collaborate with other professions and sectors. That's the key, other sectors, and adapt to a changing policy environment. Collaborating with partners outside of healthcare will be particularly important in the next decade, including organizations that represent the social determinants of health, like housing, transportation, social isolation, and food insecurity. I'm going to just hope that everyone by this time, I know in the first report, we spent a lot of time talking about interprofessional collaboration, nurses working well with doctors and social workers and pharmacists. I'm just going to hope that we are there on that one. And that needs no further explanation. But we are now on to working with multi-sectors. That's really the key in these next 10 years. Okay, next slide. So let's see here. The new report unequivocally states that the nursing field needs to address systemic racism and bias within nursing and prioritize diversity and cultural humility, defined by flexibility, a lifelong approach to learning about diversity, and a recognition of the role of individual bias and systemic power in healthcare interactions. For too long, I already said this, we have identified as being a caring profession and also maintain an identity of color blindness, but it's really stopped us from really moving further with structural racism. So we need to acknowledge and confront structural racism in nursing so that we can address the systemic barriers that keep the nursing profession overwhelmingly white and female, despite decades of emphasizing diversity. And we have made strides in this. The nursing field still remains approximately 80% white, even though white people make up 60% of the population. So we're still imbalanced there. The gap widens further for nurses in leadership positions. Get a hold of this percentage, including academia, with about 90% of nursing leaders in this country coming from white backgrounds. We all need to do a better job to stamp out systemic racism in nursing. We need to make sure that all students feel included and welcome. Nursing students and faculty must reflect the diversity of our population and break down barriers of structural racism present in today's nursing education, including the curricula, institutional policies and structures, and the formal and informal distribution of resources and power. Formal and informal distribution of resources and power. All nurses need to communicate and connect with people of different backgrounds and be self-reflective about how their own beliefs and biases may affect the care that they provide. Diversifying and strengthening the student body and eventually the nursing workforce requires cultivating an inclusive environment, recruiting and admitting a diverse group of students, and providing students with support and addressing barriers to their success throughout their academic career and continued on into practice. Next slide. Lavoria Williams, a nurse educator at the University of Kentucky, urges us to do better to help our students face the reality of racism and other social determinants of health. Medical bias is very real, and we need to find ways to introduce new perspectives to nurses early on. Next slide, slide 21. The report identifies 8 skills. I want you to pay attention to this, 8 skills and competencies that all nurse leaders need to advance health equity. Nursing leaders in academia and practice need to help more nurses to develop and expand these leadership competencies. In particular, we need more nurse leaders who are comfortable, here it is again, leading multi-sector partnerships, including with organizations outside of healthcare such as community-based organizations that deal with food insecurity, transportation, housing, and social isolation. Terry Sterling and Coletta Barrett offer two of the best examples. These are, hopefully they're in the audience and they have been speaking to you as well. They offer two of the best examples of nursing leaders who are engaging in multi-sector partnerships. We featured their work at Our Lady of the Lake. I noticed that was one of your sponsors in the NAM report. So look for that in the report, the feature on Our Lady of the Lake Regional Medical Center. Yes, and they will be speaking to you later today. So that's great. As part of their work in the Healthy Baton Rouge initiative, they championed the summer feeding program, which offers food to children who are seen for medical appointments. They also partnered with the Big River Economic and Agricultural Development Alliance, an organization that works with farmers markets to bring a farm to work program to Our Lady of the Lake. Employees making less than $15 an hour can purchase a $25 box of food for $10. The hospital subsidizes the difference, and the initiative addresses food insecurity and supports local farmers and a migrant workforce. So we need nursing leaders to engage in more of these types of partnerships. Your strategic plan also focuses on positioning nurses to influence policy. So I know that you'll be working to make sure that nurses develop all of these skills and competencies. Next slide. Right now, content about the social and economic drivers of health, health inequities, and population health are not well integrated into the undergraduate and graduate education. We determined that when we were researching recommendations for this report. Nursing education programs should ensure that nurses are prepared to address the social and economic drivers of health and achieve health equity. Schools of nursing need to integrate these concepts and competencies throughout the entire coursework, not just in little pockets or corners of courses like community health. Schools should also expand community learning opportunities, substantive education in the community, such as schools, workplaces, home health care, public health clinics, and telework settings, allow nursing students to learn about the broad range of care environments and to work collaboratively with other health and non-health professionals. Students need to actively engage in experiences that will expand and diversify their understanding of nursing practice, prepare them to care for diverse populations with empathy, and allow them to build the necessary skills and competencies to advance health equity. Next slide. The report also calls on nursing educators to increase the number of nurses with PhDs who focus on the connection between the social and economic drivers of health, health equity, and the overall well-being to build the evidence base in this area. You can read the specific recommendations on this slide. Okay, I'll give you a moment to look at these. And all of you can identify promising students and encourage them to continue their education. And I just really want you to plant the seed of pursuing a PhD in their heads. You notice I didn't mention DNPs for those of you in the know. Probably all of you will know that people entering the DNP programs and graduating is like Mount Everest. It keeps going up and up and up and up and up. And the nurses with the PhD who actually are doing the research, the science and discovery of our profession, everything that our profession is based on is done through PhD education. So I really push that. That line has been flat or declining over the years. Really want to emphasize the PhD. Next slide, please. Nurses need to feel healthy and well supported in their workplaces to effectively care for people to advance health equity. Okay, well, that's a big duh, right? You can't give what you don't have, and you can't pour from an empty cup. The pandemic has taken an unprecedented toll on the nursing workforce, including some of you here today. Before the pandemic, many nurses work in understaffed settings. They were overworked and burned out. Many worried about bullying and violence in the workplace. Many also cared for children or elderly relatives outside of work. Well, guess what? These stresses have just been extraordinarily exacerbated with COVID. Of the more than 9,500 nurses participating in a survey conducted between August 20th and September 2nd, 2021 by the American Nurses Foundation, over 75% have said they were stressed in the past 14 days. About 2/3 also reported feeling exhausted and overwhelmed. Next slide. Nurses are being pushed to their limit this whole time, and we must acknowledge that as COVID cases rise, we have rising numbers again in New York and Washington D.C. I don't know how it is in Louisiana of late, but wouldn't we all love to see an end to this? But it falls upon nurses to take care of the sick and the dying always. Support for mental health and well-being is more important than ever. We must all be involved in creating a better future for our profession. Next slide. To fully support nurses, we also need to address and eliminate racism in our workplaces. Nurses of color repeatedly report experiencing discrimination and bias within their work settings. A survey of 5,600 nurses released in January by the National Commission to Address Racism in Nursing found that 63% of all nurses surveyed say that they have personally experienced an act of racism in the workplace, with the transgressors being either a peer, 66%, patients, 63%, or a manager or a supervisor, 60%. 57% of all nurses said they have challenged racism in the workplace, but more than half said their efforts resulted in no change whatsoever. All nurses need to create a culture of equity in their workplaces. We must all be responsible for this. Our workplaces should reflect the patient population that we serve, and everyone should practice cultural humility and be aware of their biases. Implicit and explicit bias training coupled with learning about structural discrimination will be critical. Our workplaces need to recruit, retain, and mentor and promote nurses from underrepresented backgrounds. And this really goes along with that 90% leadership coming from white backgrounds that I mentioned to you earlier. We need to advance nurses of color to leadership positions where, as I said, they just continue to be very sorely underrepresented. For CNOs and managers, this could mean mentoring more nurses of color and prioritizing hiring and the retention of nurses of color. Next slide, please. This report includes a number of recommendations to create structural and cultural changes to fully support nurses. The main one is that nursing education programs, employers, nursing leaders, licensing boards, and nursing organizations initiate the implementation of structures, systems, and evidence-based interventions to promote nursing's health and well-being, especially as they take on new roles to advance health equity. I'm grateful that you're taking this work on, and again, I see all of these things and more in your strategic plan. Many organizations started this work last year, and we need to make sure that it absolutely continues. Next slide, please. As nursing leaders, there's so much that you can do to advance the report's recommendations. You can advocate for organizational policies and structures that support nurses and promote equity. This can include working to ensure that all nurses are able to practice to the full extent of their education and training. It can also mean advocating for value-based payment reform that better recognize and promote care, coordination, and transitional care. It could also mean partnering with schools of nursing to set up more clinical opportunities in your workplaces. You can prioritize programs that promote nurse well-being. And you can serve as role models of well-being. Know what's happening on the front line. Spend time with your nurses and don't be afraid to pitch in and get your hands dirty when needed. You can form or join multi-sector partnerships. You can mentor and sponsor nurses from underrepresented backgrounds. You can also set up seamless systems to screen for patients' needs and then partner with services who can help to meet those needs. You can offer more clinical placements in your work settings. Next slide. For nursing educators, you can see some ideas on this slide, including developing competencies to advance health equity, initiating dialogues about racism and inequities in your classroom, and mentoring and sponsoring students from underrepresented backgrounds in nursing. Be ambitious about what is possible and be creative. The report contains exciting examples of what a partnership with a nursing school can be. Nursing schools and practice partners could study these examples and ask, what can we do? The report provides a few attributes of what makes these partnerships great. Things like genuine immersion in the community and opportunities for interdisciplinary practice. Next slide. Deans and directors, you can create policies and regulations to protect students most at risk for behavioral health challenges, including students who may be experiencing economic hardships or feel they are unsafe, isolated, or targets of bias, discrimination, and injustice. You should ensure that all students can engage in virtual learning. You can identify and eliminate policies and procedures, curricular content, and clinical experiences that perpetuate structural racism, cultural racism, and discrimination among faculty, staff, and students. You can also recruit and put systems in place to support diverse faculty with expertise in the social determinants of health, population health, and health equity, and offer trainings to develop the skills of current faculty in these areas. You can also build a more diverse pipeline by collaborating with local elementary and high schools to expose students to nursing as a career. So when I first started presenting on this report back in May, one of my first presentations was to the National NOBC, National Organization of Getting Nurses on Boards. And in the audience was Martha Dawson, and she is the current president of the National Black Nurses Association. But I'll never forget, after that very first presentation that I gave to Nurses on Boards Coalition, Martha at the end said, Sue, I've been waiting for more than 44 years for this report. And she was just ready to jump in, and she has been doing it ever since. Last slide, please. So for more information, you certainly can go to the campaign's website. We have a lot of resources. But in terms of the report, it's so interesting because the very first Future of Nursing report that came out over 10 years ago stayed in that #1 position at the National Academy of Medicine for all of its 11 years, and nothing was ever able to take it out of its #1 position, like being on the New York Times bestseller list, #1 forever, right? When hundreds and hundreds of reports have come out until this report. Now this report on nurses and equity have kicked away that first report. It's now in #2, and this one is the #1 report. But go to the website, National Academy of Medicine. You can see the web link here. You can print off the report. It is long, but print it off. It's all free. Especially print off Chapter 11, which are all the recommendations with like the nuances of those recommendations. And we have more webinars on the website that go into deeper, take a deeper dive into some of the recommendation areas. And we have a podcast series that's very, very popular with students and faculty and frontline nurses. Wonderful. And we have policy briefs. So if there's anything you want to do in Louisiana, change laws, change legislation, change policies, you don't even have to come up with the language. Go to this website and we have a number of policy briefs on a number of the recommendation areas. So with that, I am going to bring my presentation to an end, and thank you again for having me. And let's see how much time we have left here. So we have, I think we have about 10 minutes. Is that right, Lisa and Denise?
Dr. Hassmiller, yes, that's correct. I would just like to remind the audience, if they do have any questions for Dr. Hassmiller, they can definitely put that in the Q&A feature in Zoom. And Dr. Hassmiller, we do have one question that populated.
Before you start, what I really love for people to do is think about, I know when I presented, it was like a fire hose. It could have been all new information. It could have been a repeat of information you've been hearing already. But I'd like to know from the audience, and I see on my screen you have 199 people, what resonated when I talked about the recommendations, anything that I talked about. I want to know what resonated with you. What do you think that you will remember going forward? What was most important to you? So I'd like to see people populate the chat, and I'm going to go to the chat and start looking for, thanks Denise, very informative. So tell me what you found important or what most resonated with you. But go ahead while we're waiting, Lisa, is there a question?
Yeah, so May Semino posted a question in the Q&A, and she asked, is there anything academia could do specifically to prevent structural racism? And really with schools of nursing, how can we ensure that, that's the first step to having a more diverse workforce among nurses?
Yeah, I'll first say that there's so much. If you go to the report, there's an entire chapter on education and what to do. I really recommend that you go to the report to really help out. But there are things like holistic recruitment and bringing cohorts in, holistic cohort, bringing in people who are different from each other, so there's not just one person from one particular race coming in. Policies, look at the curriculum. A lot of schools now, based on the essentials, the AACN essentials, and the report, the education chapter, are taking a good hard look at their curriculum to see if they are representing nursing equitably across the board. I talked a lot about the community experiences and just widening and being creative about where these clinical experiences take place. They don't have to be just in nursing related organization. We really want to start partnering with those from other sectors. So there's so much to be done, and that's just a little bit. So let me read a couple of things from the chat function. If you can just keep putting in what resonated with you. It says, I've been studying continuing education to advance wellness, and I'm interested in policies. Let me see here. To be able to practice to the full extent of my training. Absolutely. Yeah, Claire Millette, it resonated with me that we have so much work to do. Okay. Well, you know what? We're a big crowd. There's a lot of interest in Louisiana. It's not just you, Claire. Let's just all do it together. It's going to take nursing and critical partnerships to achieve health equity. Yeah, I really believe that nurses can take such a lead role with this. Margaret, I've been studying. Yeah, I got that one. Diversity and leadership. that one was a big wake-up call for me, that 90% of all of our leaders in our country come from white backgrounds. Yeah. Cynthia, oh my gosh, it's so good to see you online here. I miss you. This report calls out more strongly the role of diversity, equity, and inclusion. Oh my gosh, that's what it's all about. And then the first report, completely. The examples you've shared in addressing the need and how to diversify the nursing workforce are awesome. Good. Caitlin, transitioning from DNP to PhD and discussion related. Yeah. Day 2 panel will include a session. Oh, great. We'll include a session on multi-sector collaboration. That's perfect. You guys are just right on the money there. Right on the money. Let's see what else we got. There's a lot of work to be done in all areas, but how we perceive each other how we perceive each other, that starts at the beginning. That's very true. Okay.
Absolutely. Dr. Hassmiller, I do have a question for you.
Yeah.
Working within the state is one thing. We can move things forward. How do we ensure collaboration nationally with what other coalitions are doing to move forward the recommendations?
So how do you work with other action coalitions, you mean?
Yeah, how do we coordinate that? How do we collaborate?
That's such a beautiful question, because that is like the reason why we put together the campaign in the first place. I knew from, this is my 25th year of Robert Wood Johnson Foundation of working with networks and programs. I learned very early on that people actually learn the most from each other. Yes. So that's what you're getting at. Your leaders are invited 4 times a year to a quarterly call to talk about, what's happening, so they can share. And there's a lot of sharing on those calls. There's also something we started with the campaign, Hot Topics. And anybody can join those, and anybody can engage around those. So that's another way to learn from other action coalitions. And you can ask somebody at the campaign, we're working on X, are there any other states that are a little further ahead of us? And then you can and then you'll be put in touch with those action coalitions.
Excellent. It seems like that would also be a great way for other nurses to get involved, learn more about what they could do within their own state. And I know myself, being a little bit newer to the LAC here, and as we started our strategic planning, the thoughts and what I heard from those who were here from the beginning is that this was a coalition. It was going to be temporary. But yet here we are. Yeah. And so, I think we still have a lot of work that we are able to move forward and continue to do. So I definitely don't see a coalition being temporary at this point.
Yeah, and I think you guys are already doing it. But I will tell you, one of the best ways to strengthen the coalitions, and you're ahead of the game as compared to some other coalitions, perhaps, in partnering again with those organizations that represent the social determinants and reaching out to them, because I'll tell you the truth, so many times, more than you think, they have boards of directors that have nothing to do, they have no health voice at all. You might come across a food pantry or a transportation X, Y, or Z, and there's absolutely, forget about nursing, there's just no health voice, period. And we know firsthand that all of these determinants are so connected to our health. So reaching out and sort of convincing, and again, we have these policy briefs on the National Academy of Medicine website, reaching out to these organizations and convincing them about the value of nursing's voice and in helping them. I think that's just a big step for our action coalitions.
Wonderful. All right. Well, thank you so much for being here, Dr. Hassmiller, and talking with our group and the nurses and social workers of the state, to hear your deep insights and being a part of, really developing it is key. We appreciate you coming in and, being an advocate for our state, definitely our Action Coalition. So
Absolutely.
we will, keep ourselves busy trying to help
Yeah.
progress these forward, most definitely.
Yeah. Okay. Wonderful. Great work. And next time I'm coming right there in person. I love Louisiana, and you guys have the biggest heart and the warmest embrace and welcome. So just keep all that up.
Thank you. Thank you so much for being here.
Bye.
Thank you, Sue.
Bye, Denise.